Hi and welcome to my channel. So my name is Kahina. I have SLE, which is systemic lupus, along with inflammatory arthritis, mitral stenosis and regurgitation, fibromyalgia, Raynaud's. Anything else? I think that's it. And I was diagnosed with lupus age 6. So I'm making this video about what lupus is because I want to raise awareness and allow people to understand a bit better how lupus affects people and actually how common it is. So if you like this content, if you enjoy this content, if you found it informational, please feel free to share it with a friend, a neighbour, family member, share it with your dog if you want. And, give me a like, maybe a subscribe. I'll talk more about lupus and my journey and how it affects me in various different ways. And yeah, leave a comment and let me know you liked it. So let's get straight into it. So, the first question is hot topic on it. I imagine everyone watching this video's lips. What is lupus? So, lupus can refer to a collection of diseases, autoimmune diseases, and there are many different diseases that come under the heading of lupus. An autoimmune disease is where the body has an abnormal response to a normal body part, and that's when your immune system has that abnormal response, hence autoimmune. So, normal body part, heart, lungs, skin, and your immune system is reacting to it as though it is a foreign body, even though it's not. Just to let you guys know how common autoimmune diseases are, I've brought you a list of varying different celebrities who have autoimmune diseases. One who has lupus their pictures are going to pop up on here. One who has lupus, which I've always known, Toni Braxton, but as well as that there is celiac disease, see Zooey Deschanel, psoriasis, see Kim Kardashian and Kris Jenner, type 1 diabetes, see Nick Jonas, IBS, see Pete Davidson, multiple sclerosis, someone who's been in the media quite a lot recently, see Selma Blair. So they're all quite common. Autoimmune diseases are a lot more common than people think they are. So essentially the immune system is hyperactive and it will attack your healthy tissues as well as the unhealthy, nasty bits that are in your body. As you can imagine, it's not great for your immune system to be doing. Autoimmune diseases, the symptoms can affect different organs, so they may affect the heart, the lungs, the brain, skin, kidneys, liver. Any of these different organs can be affected by autoimmune diseases. Let's talk about lupus specifically. So there are 4 main types of lupus. These are drug-induced lupus, which is caused by, obviously, a drug that you've taken, not necessarily an illegal one. Neonatal lupus, which is lupus in babies. There is discoid lupus, which is the most common form of cutaneous lupus, skin-based, and there's systemic lupus, which is the type that I have. So I'm going to talk about each one a little bit more. So, discoid lupus. As previously discussed, it's the most common form of lupus affecting the skin. There are actually lots more different types of lupus, but I can't talk about all of them. The video would literally go on forever. But discoid lupus is characterised by small, inflamed, coin-shaped sort of lesions on your skin. They have a pretty crusty appearance. If you've got lighter skin, they could be red, itchy, that kind of thing, and it's only localized on skin. But this could be skin on your arms, face, could be skin on your scalp, which would likely cause your hair to fall out, on any part of skin really. They're most common on the head though, So it will be scalp, ears and cheeks. Disease activity on cheeks is actually quite common in lupus in general, but extremely common for discoid lupus. These lesions can also, develop into scarring over time, especially on people with darker skin like myself. Hyperpigmentation scarring can develop over time, like the musician Seal. That's his picture. So, drug-induced lupus. The drug-induced lupus is quite similar to systemic lupus, however it's caused by taking some kind of medicine or drug repeatedly. Usually goes away after you stop taking the drug, which is different to systemic lupus, but the effects are quite similar to that of systemic lupus, which we're going to talk a bit about later. Neonatal lupus is lupus in babies. So babies with neonatal lupus tend to be born from mothers who have lupus, and it's usually characterized by a rash on the baby which shows up a few weeks after the baby is born, and it will usually go away at a few months. There's no linkage of neonatal lupus causing full-blown systemic lupus in the future or anything like that, but it usually happens with mothers who have children when they have lupus. Neonatal lupus, however, can cause systemic issues as well, so heart blockage, you could have enlarged liver and spleen. Those are the most common in babies, but most babies sort of have a rash, similar to discoid lupus is a rash, and it will go away as they get older. So, systemic lupus. Systemic lupus is the type of lupus I have. I'm going to make the full name pop up here because it's like systemic lupus erythema. I can't say it in any case. Systemic lupus is the most severe and most common form of lupus. Systemic basically means that it's not localized to one area. So where discoid lupus is specific to your skin, systemic means it can affect other parts of your body, but there can be other major organ effects, so heart, lungs, cardiovascular system is quite common, kidneys are quite common, if you're unlucky, brain as well. So yeah, that's what systemic means. There are other autoimmune diseases which can be systemic as well. So for example, my mum had systemic scleroderma, and the systemic form scleroderma is, I have scleroderma on my shins. It's a skin condition primarily, but there is a systemic form of it. For example, Kim Kardashian has psoriasis, but there is a systemic form of it. Many autoimmune diseases, especially ones that are skin based, will have a systemic form of it as well. So symptoms of lupus are hugely varied. They can flare and get better over time. Lupus can often mimic lots of other conditions, often other autoimmune diseases, and as Dr. House says, it's never lupus.
It's never lupus.
But sometimes it is. The two main symptoms you're going to want to look out for are joint and muscle pain and fatigue. Now, fatigue is different to tiredness. The fatigue will be chronic. You will sleep and not feel refreshed. You will sleep 12, 13, 14 hours and just be tired. Doesn't matter how much you sleep, you will just be tired. It's chronic, it's ongoing, it's not acute. It's not like you've done quite a bit of work in the past few days and you're just tired. It's chronic. So other symptoms, and I've got these other symptoms off the NHS website, are rashes, which I did have a rash when I was younger, but I don't anymore. Depression, anemia, feverishness, headaches, hair loss, and mouth ulcers. During my time with lupus, I have had or still have all of these, basically. But in fairness, it's been like 18 years, so they come and go. Another symptom is often recurrent miscarriages, can occur in women with lupus as well, so that can also be a sign to be looking out for. So the most obvious visual symptom is the butterfly rash. I'm going to put a picture of the butterfly rash next to me here, and the butterfly rash, that's the thing that you see lupus with. I did have a butterfly rash when I was first diagnosed a long time ago. You won't be able to see it now because I got like makeup on and stuff, but if you look really closely at my bare skin, you can still see it, because whilst the rash has gone, it can often leave scarring, especially in those with darker skin who are more susceptible to hyperpigmentation. It's left hyperpigmentation scarring on my cheeks. So whilst the rash has gone, you know, the scarring's still there basically. So how is lupus diagnosed? Because the signs and symptoms can mimic so many other things, you'd expect it to be extremely difficult to diagnose, but actually there are specific blood tests you can run. Obviously you won't just do a blood test and they'll be like, yep, you've got lupus, but you can run specific blood tests. You can also, they will do urine tests as well to check for antibodies and check kidney function. And if they believe you have lupus, they will send you to a rheumatologist, which is someone who deals with musculoskeletal conditions, which would include your arthritis, autoimmune diseases, that kind of thing. That's what a rheumatologist does, that's their job. And you will go and see one who will then come up with a treatment plan for you. So let's look at how we can treat lupus, because it can be treated. Just so you know, before I get into treatment, there is no cure, it is incurable at this stage. And I will also put a link in the description if you wish to donate to Lupus UK to make it curable one day, but as it stands, it's currently incurable. If you have lupus, you will have it for life. But there are several ways we can treat it, so let's get into those. So for the pain and inflammation, number one, treatment will be your non-steroidal anti-inflammatory drugs, or NSAIDs. I take tons of these, always have since I was little, and that's your ibuprofen, your naproxen. They're painkillers, but they're also anti-inflammatory, so not quite like paracetamol. Paracetamol deals with the pain, but it won't reduce your inflammation. Ibuprofen actively works to reduce your inflammation, and that's what I have always been given for pain and inflammation. So that's your number one treatment really. The other options are hydroxychloroquine, which is actually an anti-malarial. But obviously in this case we're not taking it in case we get malaria, unless you live in a part of the world where malaria is common, then it might double up as an anti-malarial. But in the UK, that's not why I'm taking it. It is there for the fatigue. That's what it's supposed to help with, your fatigue, your joint pain and your skin. It's supposed to make all of those things better. I've taken hydroxychloroquine for most of my life. Couldn't really tell you if it actually does anything, but because I always take it, so I'd probably notice if I didn't take it basically. Then you've got your steroids, which could be tablets, which I used to take when I was younger. That's often where you'll start. High dose of steroid tablets, could be injections or creams, especially if you have a discoid lupus or something like that that's skin based, you'll probably get steroid creams. But steroid injections and tablets that's a way they like to treat lupus essentially. That for a long time was the go-to and really the only treatment. But steroids have lots of nasty side effects, so a lot of people don't like them. And then your final little category is your disease modifying anti-rheumatic drugs, or DMARDs. That is your rituximab, your methotrexate, your azathioprine, your cyclophosphamide. Often these are chemotherapy drugs, but taken in a lower dose than, for example, if you were to have cancer. But they are chemotherapy drugs, and they basically suppress your immune system very strongly to stop your immune system from attacking your healthy tissues essentially. They do work, but obviously side effects, as you can imagine, nausea, that kind of thing. But yeah, those are your higher level of drugs that they probably won't use until your lupus is moderate to severe. Also, somewhere in this video I will let you guys know that I'm going to link some links in the description bar so that you guys can read a bit more. So I'm going to put the Lupus UK website, NHS website, Severity arthritis website, and I'll be putting in the donation page for Lupus UK as well. So let's head on. What causes lupus? Who knows? No one knows. It's not fully understood. We don't really know. More women get lupus than men, so it's thought estrogen might affect it, and by more women I mean a lot more women. But often it's some major change in your body, so for example puberty, menopause, childbirth, you know, a change in medication, you know, like drug induced, or even something as simple as sunlight. Any of these things can be thought to bring on lupus for some people like myself. It's none of the above. None of these things had happened. It just happened. So yeah, it's not very well understood. A lot more research needs to be done into that. There is also the thought that it might be a faulty gene that causes this, and I personally, not a doctor, but I do think there's some genetic link up here. As I've already mentioned, my mum had systemic scleroderma, my grandma has rheumatoid arthritis and vasculitis. These are all autoimmune diseases that run down the women in my family. I don't have any daughters of my own to compare this, but to me that's pretty strong evidence for a genetic link. I mean, it could just be unlucky, but you know, back past my grandmother, don't really know. Her mother was born and raised and died in Jamaica, and then you don't really have the same level of healthcare you have here. But there is also a lot of research being done in autoimmune diseases being common in families. There are some different severity levels, as you can imagine. There's mild, which is characterised by joint and skin problems, fatigue. Often there isn't further organ issues, so your organs are good, but you know, your skin's having a bit of an issue, your joints are having issues, that kind of thing. Usually you're not looking at involvement of the cardiovascular system, kidneys, that kind of thing. When you start moving into moderate is when there is essentially other organs being affected now. So the most common ones are kidneys, brain and cardiovascular system. So when you're getting effects outside of your skin, your fatigue, your joint pain, that's when you start looking towards the moderate side. Severe lupus is when you're looking at severe damage to organs now. This can even lead to transplants. For example, Selena Gomez, a kidney transplant. You could be looking at transplants, could be looking at getting valves replaced, that kind of thing. And even in the most severe conditions, lupus can cause death. So I'm just going to go through some statistics now. This is the last little section. So in the UK, lupus affects roughly 1 in 100 people. So I would say every single one of you has met 100 people, and that means at least one of them probably had lupus. Now obviously that's not exactly how probability works, but you get the idea. Obviously if you know me in real life, the one was probably me, but if you don't know me in real life, one of those people you've met in your lifetime probably has lupus, at least. The average diagnosis time for people with lupus is 6.4 years. So when I was diagnosed, that was actually my entire life. So I could have had lupus from when I was born, and it just took that long to get diagnosed. We don't know. But yeah, the average diagnosis time in the UK is 6.4 years, sadly. So a lot of people spend a lot of time in pain and don't know what's causing it. So 3/4 of lupus patients experience symptoms that affect their ability to carry out daily activities, whether that be going to work, looking after your children, studying, that kind of thing. 3/4 of patients experience you know, life-altering symptoms. For a lot of them it's fatigue as well. So approximately 20% of lupus patients are children, so it's actually a lot more than people think have childhood lupus, but also at the same time it's not that common. The average age of a woman with lupus is between 50 and 54, but the average age to be diagnosed is between 15 and 40, you know, as I mentioned, puberty, childbearing years, menopause, that kind of thing. The average age of a male with lupus is actually 70-75. Lupus is more common in women than men. For every 10 lupus patients, 1 of them will be a man, 9 of them will be women. So yeah, it's a lot more common in women than men. It's most common in black women and black people in general. So black people have the highest instances of lupus, but it's also increased rates in Chinese and Polynesian people. Approximately, and this is an interesting statistic that I didn't know before I started doing research for this video, 1 in every 250 women in Jamaica develop lupus, which is a lot more common. You know, I said it was roughly 1 in 1,000 people in the UK, 1 in every 250 people. So if you take that as 250 of them are men, 250 of them are women, that's 1 in 500 people in Jamaica have lupus. So it's actually extremely common in Jamaica, but obviously the access to healthcare isn't quite the same. It might take a lot longer to get a diagnosis, and black women are actually sadly the most likely to die from lupus as well. You are 3 times more likely to get lupus as a black African, and that even increases in the Caribbean. You know, 1 in every 250 women gets lupus. And yeah, sadly we're a lot more likely to die. We're a lot more likely to die younger. So, you know, between the ages of 20 and 50 is more common, you know, for black women to sadly have severe symptoms, whereas the average age in the UK is actually 50 to 54 of women with lupus. So yeah, you're a lot more likely to be diagnosed younger. If you're black, you're a lot more likely to sadly die, and you're a lot more likely for it to be severe. So if you have experienced any of the signs and symptoms I discussed earlier in this video, please go to your doctor, especially if you are a black woman watching me. Please go to your doctor, because whilst lupus can be dangerous, it can be treated. So please make sure you're flagging up these concerns with your doctors. But yeah, that's it from me. Thank you very much for watching this video. I honestly appreciate every single view, and I hope you found this video educational. If you did, share it with somebody. If you think it's sad how little people know about lupus, share it with somebody. Feel free to donate to Lupus UK, and I will put their link in the description bar below, so that, you know, hopefully no one else has to die from lupus. And if you do enjoy my channel, feel free to give me a subscribe, because I will be talking more about lupus and living with lupus, and the next video in this little series is going to be living with lupus. Obviously this one's what is lupus, but it's going to be living with lupus and how it could affect you. So stay tuned. As always, thank you very much for watching, and see you next time. Bye!